the Maritimes to be setting up this strategy around precision medicine and around precision health. So I'm really happy to share it with you. I know you're wondering, like, what advice would I have if you were interested in doing this yourself? And I would say to buckle up. It is not a straight road. What I present, I'm sure it will be a little bit of a tidy package, but I can assure you that the challenges that you are facing were the same kinds of challenges that we were facing. And in some respects, I think a lot of it had to do with timing. We were fortunate that we have a government that ran with a platform on fixing healthcare. So I think we need to preface the successes that we're facing out here right now with that, because that is a really key piece, is what your government is willing to be funding at the time, right? So we do have an election coming up next week, and so I'm glad that I'm presenting this this week and not next week, because who knows what next week will bring. But I can certainly share with you what we have been working on to date. So I'm going to just share my screen here. Hopefully this works out okay. It might just be easier to go through with a few slides. So you have something to kind of look at here. Are you able to see my? Are you able to see this? Okay.
Yeah.
All right. Apologies for the bright green. I know depending on your monitor, that could look like a neon thing. It does not look neon to me, but if it looks neon to you, I'm sorry. So we did begin this work more than a year ago now to try and create a center for precision medicine. And one of the things that we really focused on was on educating sort of, all levels of government, our own organization, around what was happening locally and globally with respect to genomics. There is an increased utility of the role of genomics in medicine now and how it can play a part in an individual's health management. We were experiencing many practice changes and growth of our testing services based on emerging evidence. This wasn't really, that these were inappropriate test results requests that we were seeing. They were very much appropriate, but it was creating a lot of pressure on our teams and on the resources that we had. There were many changes in use and the access of genome diagnostics. We had a lot of clinical areas that, they may be engaging with research and getting quote unquote free genomic testing for their patients. We had others who would maybe go to conferences and come back and want to have certain testing performed. And so we were really operating in a very reactive way and not in a proactive planning type of way every day. And so we really needed to have this transformative change. And so that was really what I wanted to highlight to our executive team, as well as government as well. And so when we talk about building systems transformation, we had to look at how we were going to approach that. And so there were a few things here that we did. And one is focused around improved access to care, because I mentioned our government had been running on fixing healthcare. One of those key areas was around improving access. And so we realized we had a way that we could help with that and improve access. Some of the things that have been happening in the Maritimes with respect to genetic testing is that most of the testing was being funneled through Maritime Medical Genetic Services. And so we aim to mainstream a lot of the genetic testing to subspecialties like cardiology, immunology, oncology. And so we really wanted to really impact those wait times and really get those down. We focused on what Nova Scotians would see and feel through this, because that was part of what the government was looking for, was that kind of information. And I say that because, I have a physician co-lead, and she and lots of physicians I know, they really like to show a lot of data, and they really want to say, if I just show all these numbers and I show all this and I have all my concentric circles in my data and whatnot, then they'll see it and then they'll want to implement it. But it doesn't really necessarily work that way if it's not clear. And so we really focused on creating a clear ask and a clear message. And that it did have a human-centric approach to it. Like, what would Nova Scotians see and feel? So we did focus on that. We secured leadership support. So our executive also had to understand the work that we were doing. So we are a diagnostic genetic service here in the Maritimes. We offer that testing for our maritime provinces. We are focused on inherited disease, but we do that testing for people, whether they are prenatal to 92 years old. We have a lot of adults in our service. And our executive weren't even necessarily aware that that was the service that we were offering. So we really wanted to educate them on this. But a key piece was in doing that and in showing them the utility of doing this, it also meant that the IWK was taking this forward as their key transformation initiative to the government. So when you're approaching it from that perspective, your hospitals already likely have a good relationship with your governments, hopefully. And so there's a level of trust there. If you can get your organization to be presenting this as their key transformation initiative, then there's already going to be a certain level of trust and a certain level of belief in the product that they're trying to move forward. And then we needed to get investment in this vision, and we have been doing that really for the last 10 years through research. So yes, we have a foundation, and we haven't really engaged with the foundation too much. Not that we don't want to, or that we won't in the future. We'd love that partnership, but we've really been focused on research partnerships and on the ability to implement new diagnostic pathways, implementing exomes, implementing infrastructure like instruments and things like that through research. And we've been really successful on that. And because we have a long history of doing it, we got kind of good at it. So we kept sort of capitalizing on that a little bit. And that was really key. And so I think that that's something that, you know, people shouldn't underestimate either, is the ability to seek investment from other places. Once you're able to show some success in some of these areas, when you're taking it to your executive or you're taking it to the government, you can show that sort of as wins that you've had in the past, and it lends credibility for sure. And then we also wanted to share how we would link a center to the precision health community, because the data is so important. Like, we think about it as, you know, a genetic test and what this result can mean, but we really understood that the future isn't just in genetics, but it's in linking a lot of information about a patient. It could be imaging, it could be CBC results, it could be anything. And so we really wanted to have a focus on how we would link this information locally as well as nationally, internationally, and things like that. So we really did want to highlight that too. And then going back to, like, how do you sort of present it? The way we presented it was kind of in these pillars, right? And so really it's a broad topic, precision health. There's a lot of different areas in it. Even in the precision health program at Calgary, like it's a broad spectrum of things that you're learning. And it's no different than when you're trying to put something like this in practice. It's broad. And so how do you present that to either your organization or government in a way that is meaningful and not too overwhelming? And the way that we did it was through a focus on quality, because we are an accredited facility. So even though we would be going through potentially immense transformational change, we needed to make sure we were doing that in a safe way, and in a way that was still adhering to our quality management system. The education and community engagement is a really big piece of what we're doing. You know, on the far right, you see the piece around data governance, and, you know, there's a lot of, you know, AI applications that are coming out, a lot of data sharing, and some people are not going to be as comfortable with that as I am. And we have to be making sure that we're engaging with patients and with people in our populations so that we can hear from them and understand where do they want us to focus? Do they want us to share data? Do they want us to link it? What does that look like? So we've been putting in a lot of effort in those areas to make sure that we're on the right track. And then genome diagnostics and translational genomics, you know, really around implementing research into the into the clinical environment has been a really big focus for us. We haven't been in the business of doing research just to research for a very long time. I would say all of the research over the last 10 years that we've been involved in has resulted in us implementing testing in a clinical way. So we have that as a whole pillar, also because I mentioned we've had a lot of success in partnering with research for funding. So that was another reason why we did that. And then the data governance is a really big piece of it, and we can't underestimate that, because there's a lot of data, and we need, where do we store that? How do we safeguard it? How do we ensure that if we are using data for research that, you know, we have the appropriate consents and reconsents, because some of these, you know, sometimes you are consenting for your child and in 10 years they are no longer a child. How do we approach these things? So there's some thorny things, right? So it's nice when you can make it into a few little pillars, and it separates things out nicely. But I want to go back again to the education piece, because it's all fine to sort of set yourself up and say this is what's going to look like, but how do you staff that, right? And so we have a partnership with the Michener Institute for Clinical Genomics Technologists. We've had that in place for a long time, but we can only send a certain number of technologists there. And so we are looking at creating a local program so that we would be able to continue to sustain ourselves with technologists that we require. We do require licensed technologists in genetics technology for this work, and as well as creating an accredited training site for CCMG lab scientists to be able to do the reporting. So we're also looking at that, and that should be coming in 2025, but I'm not sure exactly on the month, but we are working on that. So that's also been a key piece of it, was to not just say we were going to do all of this stuff, but then not also have a plan for how we would staff it. That was key for us too. And then the technological solutions, and I'm not going to go into these because some of them we aren't even going to do, but I highlight it because we're not going to do them, but because we wanted to educate people on how quickly things were moving. And so, yes, we will be doing non-invasive prenatal testing and fetal RHD and things like this. But OGM, maybe not. Probably we'll go toward a whole genome sequencing, potentially. And we wanted to ensure that we were going to have the autonomy that if we got funding, if in 2 years from now, the technology and the landscapes changed, that we had the ability to get what we needed then. And so that's also been supported, not just by our institution, but also through the government. So that's also been great. And then the data governance piece. So there's a director role, and again, I have a medical co-lead, and then we also have someone who is working for the data governance component of this, because it's large. And so we've actually created a center for clinical bioinformatics, and that center is IWK wide. Like, it can't just be for clinical genomics, but we had to get the support of the organization, because I had mentioned it's not going to just be genetic data, it's going to be other data too. So we needed to create a plan for that, and to be able to support future research, but also future clinical uses. And we needed to, have plans in place and strategies in place to deal with AI, with machine learning. And so having this data governance piece really, really helps. It also sets us up well to work with industry so that we can, improve the user experience for some of the softwares that we use, or, help with connected analytics and things like that, and to really try and promote this kind of work. So I'll kind of stop there and sort of see if there are any questions, or Lena, if we want to go to our, own questions.
Yeah, so there's been one question that's been asked so far in the chat from Joe, who's asking, is there any work being done in precision health and genomic research related to autism?
So Probably. What we have been focusing on in terms of our research has really been related more to like the entire pipelines. So we're looking at implementing genomes, or looking at RNA-seq or methylation, things like this. So not specifically with related to autism, but we certainly know that that is an area of focus locally for sure. I see another one too. Are there any other centers in Canada used as a template? So yes and no. There are other centers that are well-funded for sure. They have a slightly different governance structure to us. And also one of the differences between how we kind of operate and some of the other places in Canada is that if you take a province like Ontario, it's really large. And so there are certain hospitals that are doing certain testing. So you would have, say, all of your prenatal testing being done at Mount Sinai. You may have all the cancer being done at Sick Kids. So they have structured their testing streams where all of the testing for the province is going in certain areas. But for us, we have been doing all of that testing. So we're a much smaller area. We have about 1 million people. We're forecasted to be 2 million people by, you know, a not too distant future. But that's a very workable population number to try and do something like this, right? So it's also important to recognize that we're not that huge, so it's easier. But the center that I did use as more of a template was actually Children's Colorado. And they have an institute for precision medicine. And we met with them. We also met with industry partners of theirs who also helped to kind of give us a sense of the plan that they went toward to try to get funding as well. Sometimes you can get donors, and if you have a donor, then you know you can kind of take off from there. So it all depends sort of on people's unique situations too. And yeah, the unique characteristics for us, I think, is that we do all of the testing, right? All of the inherited conditions are all done here at the IWK for the Maritime provinces. And again, that population size is it's a very workable number.
There's a question here from Ivy. Maybe we'll just keep going through because there's lots of engagement here from the audience. So maybe we can just keep working through these questions.
Yep, sure.
So Ivy had asked about the structure that you guys have developed, informing those 5 pillars. Did you draw on at all on the PHP specializations? Were you aware of those at the time when you guys started developing your model? Because it looks, you know, there's a lot of mirroring going on and in the curriculum.
Yep, there is, and I was aware of those. It wasn't entirely intentional, but certainly the education piece was a highlight from the program. I definitely did use that, and also the other piece too was early in the foundations, we did like part of that program in the foundations course, we needed to create an infographic, and it was really great feedback on how to say what you needed to say in a concise way. Now, you may think I failed the course, but it was actually really important because that was so key to educating others. They would get lost in a lot of information, and it was really important to be succinct about what is it exactly that you're looking for and what will the outcome be, and these kinds of things. Just kind of get to the point. And so that definitely came from the program for sure.
Awesome. And which is, as Ivy mentioned, it's really reassuring, right? That there's a lot of that overlap and that we know it can be implemented well and it works well in reality, which is great. And so I guess there are a couple of questions now, I think, on the data and how you're recording your data, how you're analyzing your data, and probably along those lines as well, how you're keeping your data secure and private. You know, happy to hear your thoughts. How have you guys addressed that?
Yep. So it's a whole big section for us. We use Illumina platforms is what we're using, and so we have cloud-based storage. In Nova Scotia, we have to put everything through cyber and through risk assessments, threat risk assessments. I have not been able to get anything, whether it's software or an instrument, going in less than 9 months because it needs to go through such rigorous review. So I think a lot of other provinces will be in a much better position than what we have been, because that has been one of the biggest issues, is because where our data is being stored, who is accessing it, those types of things are so well vetted. We are in a pilot program with AWS and a company called LifeBit, because we want to create a cloud-based analytics solution so that we are able to analyze the data on a broader scale. So how we can use this information to improve outcomes. So we do have some pilots involved in that. And those pilots, again, are all going through cyber, through risk and legal, we have all these policies and procedures. We have data governance plans. There's legislation that our legal team uses to ensure that we are meeting all of those regulatory requirements. So I don't know if that answers your question.
I think so. And I think, Kumar is the one who had asked that question initially. So feel free, Kumar, to let us know if that answered your question in the chat or if there's anything else. Oh, he's got a follow-up question. Is that pilot program data sensitive, and how is data privacy being maintained?
Yeah, I mean, I can put you in touch with the person who is leading it, because yeah, we have to go through, like, for research, it has to go through research ethics, and any patients need to be consented. We do have consents on our requisition. Some people agree to have anonymized data used as part of research, and so that's what we do with ours. We have a system where our go forward, we have a unique DNA number for every individual, so we don't have any personal information, name, postal code, that sort of thing. Although I will say, what is interesting is that we need to kind of examine that, and we have to look at how we what we consider private, because if you take a province like Nova Scotia, where we have the highest rates of lung cancer in Canada due to radon and arsenic exposures, and that combined with a person's genetic profile, having your postal code is going to be an important piece of the puzzle, right? So we do have to work with our ethics boards and things like that, and making sure that we're working with our patients so that they can also understand why some of this information may be required and how it could help them, because the environment impact our genes. So that's also that's important too.
Yeah, that's a great point. And I think that's where, a lot of the ethical considerations in precision health moving forward might be different, right? Compared to what we've historically looked at in terms of, consent forms, and how to actually provide informed consent, and what data privacy actually means, and how to share that information when a lot of that might be very personalized and might actually end up being something that can identify you going forward. So lots of things to consider for sure. There was a question from Umaru, which I think lends nicely now into some of the follow-up questions that I had too about, so his question is about, in this innovative model that you guys have proposed, what kind of interface do you already have with the existing clinical care structures and models? And particularly, I think he's a primary care physician here locally, so I think he's also interested and curious about primary care implementation and integration, as well as those tertiary care models.
Yeah, so we have an electronic health record, or we will, and so that's one of the aspects, in terms of how we're trying to build that, and what information will be available to patients themselves and to primary care as well. So we are trying to integrate that data.
Perfect. So I think that was going to be some of the follow-up. So maybe we can chat a little bit about that kind of next. And again, everyone feel free to put more questions into the chat, and we'll just keep picking them up. as they come through. But I was wondering, so as part of your, because you mentioned that you had an executive team, and as part of that executive team, you then met with your organization, and then you got your organization on board, and then you talked to the government. And so I'm, the way you've outlined it nicely, I can see kind of this process map kind of as you started small and then kind of gain momentum. Do you mind sharing with us kind of who you initially started with? Because, you mentioned to us, like, if we're interested in doing something like this, buckle up. So, buckling up and getting people in the car to buckle up with, like, how did you start that process? Who were part of those initial steps in that executive team? And who were those initial stakeholders?
Yep. So the initial stakeholders were my VP. So I report into the VP for clinical care. And so I met with her. My co-lead reports directly to the VP of medicine, and she was meeting with him. We were also meeting with them together. And we were really sharing the evidence around why we needed to have a strategy for this, right? So obviously we were talking about our pressure points. We were talking about how we were reactive and, we weren't able to get ahead of this, but we also wanted to really highlight through evidence. So we were showing them peer-reviewed journal articles. We were showing them the CADITH 2023 watch list, which outlined all of these precision health items to watch for, right? So we were trying to show them, really look at what's coming, because this is an expensive service right now. But if we do nothing, we are going to, one, be behind the 8 ball for quite a long time. We'll never get ahead, but we are also going to just be, it is just going to drain the resources like you wouldn't believe, because people aren't going to use less genetic testing, right? Like, this wasn't, we do choosing wisely. Like these aren't inappropriate tests that people are requesting. It's just that because the utility of the results are growing, there is more evidence on how it can guide a patient's management. These are real requests that people have for their patients, and we have to support that. And if we're not supporting it internally, where are we going to be sending all these requests, right? And are we then, we're then funding infrastructure for somewhere else to provide these services. And, Nova Scotians and Maritimers alike should be able to get that care here. And we should be building these services so that people can work here, and we could be attracting the best talent, right?
Totally. I think that's the vision, right? Is like having that vision and the foresight, and getting the right people engaged to recognize the long-term benefits of doing it. You mentioned about your long-standing relationship and partnership with their genomic technologists and like having some of that expertise locally. And I'm curious, was that always part of your publicly funded care model in the Maritimes? So all the genomic testing that you're alluding to that was being done, was it all covered, or was any of that privatized, and did you have to then go through a process to try and get it funded in order to develop that partnership?
So it's all funded. So, and this is a little different from, say, Ontario, where the Ministry of Health would approve certain genetic tests. That wasn't our reality. What had happened, this was many years ago, the IWK, and so my portfolio was given the funding to be able to offer that testing. And so we and Maritime Medical Genetics at the time, because at the time they were ordering most of the tests, like say 90%. That's now down to about 40% of the testing. So we're getting testing requests from 60% are from other practitioners requesting it. But we were given that funding, and we were entrusted with the responsible stewardship for ensuring that we were managing that budget ourselves. So we didn't, if someone had a request for testing, it was within our purview and our leadership to be able to approve that. We didn't have to send it to downtown to approve. We do have a patient pay model for non-invasive prenatal testing. So we offer that locally for certain individuals who meet a certain risk threshold. But everyone needs to be aware that that's a test that's available to them, and we do facilitate it, but that is patient pay. But that's the only one.
Perfect. So then there's a follow-up question here in the chat from Joe about wanting to know, he's wondering, are there partnerships with pharmaceutical industry? So example, rapid diagnostic testing and Roche within your precision health umbrella?
No. No, so we don't have any pharmaceutical partnerships yet. That is something that we are exploring. We're not opposed to, but our organization has a different level, I guess, of comfort with that. So some of what we're building is really challenging the culture here. So at this time, no, but we are interested in it.
Yeah, small steps. I guess so that actually, I don't think I see any other new questions. So maybe I'll move on to kind of going back to some of the things you touched on. So obviously this has been a very long, not just a quick, process. It's taken years and years. As you mentioned, research, smaller steps, and smaller implementations that have just kind of fueled and led to some of this momentum. And I was just wondering, because you were saying for the last 10 years, pretty much all the research that you guys have been doing has been focused on implementing something. So doing research in order to implement it into your system. And I'm just wondering if you would mind giving maybe a couple of examples for what kinds of small projects you did do that ended up getting implemented, just to kind of give the audience a sense of what kind of projects or what kind of level you're actually referring to.
Yep. So we were referring a lot of exome testing outside of the province, and we were part of a Genome Canada applications partnership program funding where we implemented exomes in the clinical environment. So that was one that we did. Another one, which is one that a lot of provinces did, was with SMA. So we had funding through Muscular Dystrophy Canada to do a proof of concept, I guess, or to run a pilot to show that we could validate and offer SMA testing as part of newborn screening. And so that was another example of how we did that. There are other newborn screening requests that are out there too, that are kind of along the same lines, where they're looking at, we'll support the validation, but then there's an expectation that that would then be implemented.
Great. So Umar had a question that he's posted in the chat. He's asking about unfettered. Do you guys have unfettered access to your existing public health databases?
No, we don't have that. We're not sure with the electronic health record what we will have access to, but we aren't going to, like, there would have to be some process for that and for us to integrate. Like right now, we're two health authorities. There's IWK, there's Nova Scotia Health, and there's no sharing of the data there either at this time. So, we would have to look at that.
So you mentioned, I know there was a discussion about your pharma partnerships and how those are hopefully coming along. I'm wondering if you would mind touching on a couple of your industry partnerships. You did mention a few, but would you mind kind of outlining maybe a few more specifics along
Yeah,
that?
sure. Yeah, we have those. And then we also are looking at partnering with local companies as well. So we do have a pilot going with a small company that is AI based, looking at patients' journey through the healthcare system. And so we're looking at, okay, that's great. You have this information, you can kind of map a trajectory for a person. And we felt, how can we overlay that with genetic information, which will also be meaningful? So it's just adding, more information to inform what that journey could look like. So that is one. There's another one with a company called Virtual Hallway, which traditionally has been used here to link a healthcare provider, a GP. They have a question about their patient, and they're wondering, should I refer him or her to a specialist? They can engage the specialist through a virtual hallway conversation about what to do. But we actually leveraged that platform to offer the education modules for the mainstreaming. So that was another sort of partnership that we
Yeah, that's a really innovative idea, because we do have something similar in Alberta called Specialist Link. And it is an interesting way to kind of get that expertise and build that knowledge, as well as kind of improve and empower our providers as well with some of this information, right? So that's a great way to innovate it. I guess the next question that I had that kind of lends itself from there is, so obviously you have these different partnerships and you have different stakeholders that you've had to engage. So what did you do, or how did you ensure your vision aligned with all these different stakeholders? Because I'm imagining that some of them may have had competing visions or competing values. And so how did you guys address that and move everybody forward with a common goal?
Yeah, well, we focused on what was common, like for sure. And, you know, I don't know. I've been at, in healthcare for a while, and every few years you get a new strategy, but I've yet to see a strategy that comes through that doesn't have innovation in it, right? Or, right. So like, it's a bit of a regurgitation of similar things often. And so we did really want to focus on that. I would say that some of the competing, I guess, visions or whatever kind of goes back to what I was saying about the culture and about the comfort with some of the partnerships and industry partnerships, and just the need for our processes to align with being more nimble, and they aren't right now, right? So we're one of the areas that is really, we're really growing. We have a lot of innovative opportunities, and so we're really pushing those streams, and that is hard because the process is not set up to onboard AWS. Let's just say that, right? So so there's a lot of bureaucracy involved with this, regardless of which pillar it is, whether you're dealing with human resources and trying to onboard people, and that's taking many months, or whether it's a procurement contract or what have you. Like, that part I think is the most challenging in terms of kind of competing priorities or values. And then there's also, in terms of challenges, just the reality that, yeah, when people are asked to weigh in on this, or, do they want to be part of it? Yeah, sure. Until it happens. And when the rubber hits the road, not everyone is as engaged as they said they would be, right? So you have to also kind of be aware that that could be happening as well, and some people or some teams or what have you, they just may not be as engaged when it's crunch time. So that's something else to kind of be prepared for, because you might be surprised who those people are. So yeah.
I think I've got another question here from Umaru. So as we've talked about now industry partners, and we've talked a little bit about your government engagement, what about engagement with patients and with your populations? He specifically mentions, patient special interest groups, but I'd also be curious to hear how you've engaged with, marginalized populations, or patients who might be more hesitant to share their health data and be part of a system like this. Yeah.
Yeah, so we do have, and again, this is kind of like, it kind of goes back to what I was saying about, like, some sites in Canada even are well funded for things like this. It's more difficult for us where we are smaller to have access to some of the teams to do some of this work. But there are teams here at the IWK around equity, diversity, inclusion, and things like this, that have been supportive. And so those were teams that I was engaging early to ask them for guidance on, how to structure this and what that could look like. So I've been working with them, and what we're looking at doing is targeting specific populations and special interest groups, and not just having sort of a blanket, and also targeting things too, like, these were things that I just don't really realize, but they were saying it also depends on how you're going about doing it. So you may have an online survey, and apparently a lot of white people will fill that out, but it's not necessarily going to get the information on the groups that you're looking for the information on. So we're really trying to tailor that, and we're creating focus groups, and we've been engaging people specifically from communities who will lead those groups. And the challenge is that right now, like in terms of going out and having those conversations, like I'm kind of it, and I'm not the right person to be doing that. So we're trying to look at, okay, who else can do some of this, work and have meaningful conversations, and conversations that, you know, will instill trust and foster greater engagement. So we are looking at that.
And what has the initial responsiveness been like? Has it been positive? Has it been a bit mixed?
It's been really great, actually. I've had a lot of feedback. Not all people think that I shouldn't go. I feel I shouldn't, but it's been quite supportive. There are a lot of people who recognize that in their communities there are inequities, that there are that the healthcare is not tailored to them. They are saying, you know, in my community, a lot of us have heart disease, or a lot of us have diabetes, and why is that? And what do we do? And there's people are struggling, across the board, right? And so, what's important to me is that when we are bringing people through our system, that we're comparing apples to apples. And so whether that is through the clinical testing that we're offering, or whether that is through research or what have you, we have to be mindful that we're not just magnifying the inequity that already exists. And so we are aware of that, and we have a lens on that, and we're really trying to not do that, but it does require the engagement. And so far, it has been very positive. One of the things that we did, ages ago, but we had CF testing, and we were doing that, it was set up in, probably the 1990. And it would be great if you were white and you were from New Brunswick, and we were catching the variants that were local and were common. But our population in Nova Scotia does not look the way that it looked in 1990. And so we needed to open that up and change that panel, move from a panel test to a next-gen sequencing platform, so that we were able to have a much broader read, so that it didn't matter where you were living, and it didn't matter from what country you originated. When you came through the doors, we could assure that if you had CF, we could find it. So that was that's something that we resolved, and we saw the need, we made that change, and it's something that we're mindful of whenever whatever the tests are that we're developing. We're trying to make sure that we are being as equitable as we can.
There's a question here Joe had, where he was just curious as well about that. So are you doing ongoing kind of gap analyses, and are you doing these kinds of evaluations to try and determine what niche areas or what areas would benefit the most from the type of precision health that you're bringing to your population? So, for example, you mentioned oncology and diabetes as kind of areas of focus. Have you done the background, the analysis, and the gap, like looking at that as a need, like from a needs analysis perspective?
Do you mean like compared to other provinces, or just what gaps exist here and where are we focusing?
Yeah. I'm not going to speak for Joe. I think he means specifically in the Maritimes. But Joe, I'm not sure if you want to clarify, because I want to make sure I'm actually asking the question you wanted answered. Yeah.
Yes, Maritimes. Yeah. So I don't think so. Not a formal gap analysis. So the reality is that we're doing we're focused on the inherited conditions. So in terms of like diabetes, like MODY or what have you. But we're doing the diagnostic genetics testing for all of the Maritimes for all of the conditions. So in terms of like, where do we start? We're looking at, sort of our own internal data on what our volumes look like, but also on what areas have therapeutic pathways that we need to be addressing. So whether that's DYPD, mutation testing, whether that is with PARP inhibitors or what have you, we're also looking at like what exists for the patient on the other end. So if we know that we can target certain therapies to for people, then we are going in that direction. But we are responsible for offering a robust service regardless of that subspecialty. I don't know if that makes.
So I think, to me, I think that was great. I think that Umar, okay, so Umar was asking now, yes, so thanks, Joe. So it looks like you did answer his question, so thank you very much. And Umar was asking now, follow-up, would you be delving into polygenic risks?
Yeah, no, so we would love to do all of this, like, don't get me wrong. But one of the things that we're also really cognizant of right now, where we're just starting, is we have to be systematic, because we could get spread very thin very quickly because there are a lot of pieces to it, right? But like, one of the things that we're actually quite interested in is population screening, because there's a lot of evidence around the screening of young adults for conditions where we could be offering either earlier mammograms or lung cancer screening, whatever, right? So we are cognizant of those types of things. We've put in several research proposals to try and almost pilot that in some ways, because we know that there's evidence there, and we think we could get some good outcomes on it. But it's a lot of people that you're just sequencing, and so it's pretty resource intense when we look at just kind of our bread and butter, what we just need to be doing clinically. That I don't know that we're there yet, but we would have had to get there if we had got accepted.
Yeah, totally. So that's perfect. So just because we're kind of coming to the end, we have about 8 or so minutes left. I do want to touch a little bit, because you mentioned it as well, on kind of lending itself from what you've already talked about now, the sustainability of your model. So, how do you see this going forward in the future? You mentioned there's an upcoming election. We all know that sometimes a lot of this is unfortunately or fortunately, depending on the situation, really reliant on outside external forces like government involvement, public funding, public approval, and then budget, right? So, short-term and long-term kind of budgeting and sustainability wise, what are some of the considerations that you guys have made?
Yep. So what we proposed was a 5-year plan. And and I had mentioned, when I kind of talked about all the various technologies and different ways that we could go and all this sort of thing, like, we do have the ability to alter course if we need to. And that isn't just with technology, but it also includes positions. So, for example, we were fortunate to secure additional seats at Michener for the last 2 years. And so when we were funded, we saw that as an opportunity not to, try to get more technologists at this time, but to add additional genome analysis experts, and to really try to make sure that we were closing those gaps around the data analytics, because that's really growing, and we need to make sure we can't be offering more testing if we don't have that piece really solid. So we had the flexibility in that. So that's one of the things, and I don't know if that's at everybody's government, that they, once you're funded, you have that autonomy to do that. I'm also relatively new at this, so I'm not sure if that's just unique to here or not, but we went with it. So that allows us some flexibility to be able to sustain ourselves, because we can move because it's rapidly changing. So it's hard to say next year what we will really need. And then, because you don't know what Illumina is going to make next. So it's hard to know where you might be going, right? So there's that aspect of it. It's true. We have an election, and we could have another government. We don't know that. Even if we do have this government, it's hard to imagine that they're going to fund healthcare for the next 4 years the way they have already, right? So, we have to also recognize that, but we've done what we could, but it will require us every year going back to the drawing board and trying to advocate for what we require. A really important piece of it is for us to be showing our results, right? So when we show, these cardiologists are ordering these tests for their patients instead of waiting for 2 years at Maritime Medical Genetics, and we just cut 18 months off this person's wait, that's powerful information. And so we have to be showcasing the the work that is really contributing to improved outcomes, right? So we do want to highlight that because that will help us to, you know, have the credibility to continue to move forward. So we do want to show that as well. It's also important, you know, if you are funded, that you do get the positions you say that you need, that you do get the equipment you say that you have to have, right? And again, a lot of it is credibility, but it's also it's part of, you know, building that rapport. So.
Perfect. Leanne, this was really fantastic. I think we have time maybe just to touch on a couple of things. The very last thing I think just relevant for, there's a lot of people I see in the audience today who are either already part of the Precision Health program or are interested in it. And I know Amy had asked earlier if you would mind just kind of giving us a quick kind of update on your background and how you got into innovation in precision health in the first place. And then as a kind of an addendum to that, you know, what brought you to Alberta to do the certificate program and what it was specifically about that, what you've learned so far that's helped your initiative? Just in minutes here.
Yep, sure. So I actually began my work career as a research scientist for a pharmaceutical company, and it was one of the 5 largest in the world. So I don't have that same opposition to pharma the way a lot of people in healthcare had. So I did research for on the development of pediatric vaccines against RSV for about 7 or 8 years. And then I was also at the NRC looking at cancer biomarkers before I came to the IWK and became the manager. At that time, there were 2 divisions. There were cytogenetics and molecular diagnostics. And over time, it became necessary to merge those because one was increasing rapidly in growth, the other one was stable or decreasing, and it was getting very challenging just in terms of moving people around and things like that. It also, we knew we were moving in a you know, a more genomic kind of way, and so we merged them into clinical genomics probably about 7 or 8 years ago. So I've been the manager for genomics for about 14 years, and you know, I have to say it was this wasn't the first time that I brought this up. So you know, the need to be more proactive. It does depend on who is in leadership at the time, and those things typically are always changing. So sometimes you're lucky. And then in terms of Alberta, so I had looked at different programs, and many of them were American, and my concern was because what I face a lot, like even in using Colorado Children's as an example of a great system that's set up, I still get challenged all the time on, this is a Canadian system, it's not going to be the same, their marketing, and so for me it was important that it was Canadian, because I felt that lent more credibility to what I was saying as well. So, and it's been great. I quite enjoy it. I don't enjoy the time, the 8 to 11 p.m. time, but I know there's some people that have it worse than me. So
well, it takes a lot of dedication to attend those sessions for sure, and a lot of commitment. So, well, I think we're right on time, right at the minute now. So maybe what I'll do is, I think we've addressed all the questions that got posted in the chat. Maybe Leanne, if you don't mind putting into the chat your contact information if you're comfortable, and maybe if people have more questions or would like to stay in touch, then they can. But I just want to say, on behalf of the program, thank you so much, Leanne, for sharing your journey and your process, and also for paving the way for future generations of precision health implementation and collaboration. This was a really fantastic session. We all wish you obviously ongoing success in your endeavors, and we look forward to hearing more and more about all the ways that you're implementing and innovating and challenging the system. I want to thank the audience members as well, because there's been tons of active participation and engagement, which we always, of course, appreciate. So really happy to hear the positive feedback that this was a really helpful session for all of you as well. We're going to look forward to seeing the rest of you at the rest of the sessions this week and growing our precision health community here in Alberta. So I think Leanne's left her contact information here. So if anyone is interested, feel free to reach out. And yeah, perfect. Well, thank you guys all so much. I think we probably are able to stick around if anybody does have any questions for maybe a couple minutes afterwards. Leanne, I don't know if that's something that's possible for you or not.
Yeah, that's fine. Yeah.
But yeah, otherwise, thank you again, everybody. And yeah, looking forward to the rest of the week.
Excellent, thank you. Yeah, hopefully you have some material that you can use to build off for your own programs. Thanks, Lena, for doing this.
Oh, my pleasure. Thank you.
I appreciate it. Thanks so much.
To you both for your expertise. That was really interesting.
Oh, okay, good. I wasn't sure.
So great.
It's interesting to me, but I don't think everyone necessarily shares that passion for genomics and whatnot. So.
Oh no, I think so. Oh, I think people are interested in that. Definitely.
And I think like this is just the natural next step in terms of everything that you learn and you hear about in terms of precision health. Like the next step is, how do we get this to people? How do we change the system to allow this to happen? And it's sometimes so daunting to think about all the things that need to happen to get it on board. And you hear about all the challenges and the barriers, and that's sometimes all you hear. So it's really great to hear about a positive experience and a success story where we know it's possible to do, and it's just a matter of patience, time, and engaging the right people. So
yeah,
it's really heartening to hear that experience, I think, for a lot of people who may not have known that it was possible to do.
Yep, it's definitely possible. It's definitely possible. But it is a lot of work. There's just government, right? It's a hard sell and it's a hard slog, and everyone starts with no. So, you have to kind of, be prepared for that, because that's been the most challenging part. And it doesn't matter where it is. And that's what, they had actually said that to me in Colorado. The medical head had said, I worked so hard to, put this in place, and it's been so successful, but it doesn't matter what my next ask is. They never just believe that it's going to be okay. It's always scrutinized. It's always, oh, I don't think we can. She said, you would think by now that, when I was bringing something forward, they would think, oh, this is going to be great. And she said, no, it's never great. So it actually made us feel good, because we thought we were doing something wrong. We were like, oh, why don't they believe us? Why can't we get this message across? And it turns out that's just people. So
yeah, that's good. Then nobody will take it personally here after hearing that.
Yeah.
I was just going to jump in, and I'm going to stop the recording. And if anyone else has other questions, they could maybe go ahead with the questions without feeling like they're being recorded. So I'm going to stop that now.